Mangled extremity severity score MESS. It's a tool utilizing limb salvage success surgery versus primary amputation at the time of presentation. High specificity but low sensitivity for predicting amputation. Score of 7 or more, highly predictive of amputation. Age less than 30, 0, 30 to 50, 1, more than 50, 2. Shock, systolic BP more than 90, 0, transient hypotension 1, persistent hypotension 2. Ischemia, pulse reduced or absent, perfusion normal 1, pulseless paresthesia, reduced capillary fill 2, cold paralyzed limb 3. Skeletal injury, low energy, simple fracture, dislocation, gunshot wounds 1, medium, open fracture, dislocation 2, high motor vehicle accident, rifle gunshot 3, very high gross contamination 4. The first two, age and shock, starts from 0. If ischemia time is more than 6 hours, the score is doubled. LEAP study in 2001 stated high specificity but low sensitivity to mangled extremity scoring system, highest impact on decision making in severe soft tissue injury, absence of plantar sensation not prognostic of long-term functional outcome, return to work was not statistically significant, reconstructive patient at higher risk of rehospitalization. Sequence of salvage: first vascular shunt, then X-fix, then debride, then formal vascular repair.